Hello everyone, I'm Dr. Wang, and I'm really glad to see you in internet. I'm from Shanghai, China, and Taikang Bible Dental Hospital, and I'm one of Professor Shen's team. As you can see here is a big picture of our team on the Chinese New Year, this New Year. And the in the middle with the gray hair, the gentleman is Professor Shen Gang. And our team now have six orthodontics and two general dentists, and more than 20 orthodontic assistants and more than 30 nurses. That's the whole picture of our team. And in 2019, Professor Shen started the GS program with Smarty. And I'm really glad to join this program from the very beginning. And I will show you the pictures, very rich pictures we take together. And uh, every week we traveled around the country to give the lectures for the doctors. And as you can see, every lecture, every summit has more than 500 doctors join the summit. And until now, we have the lectures and the trainings about the Smart GS have reached over 200,000 doctors around the world. That's a really big number. And here's a map of smartest solution from S1 to S20. Due for the time, today I just talk about the S8 SGTB, one of the most important device in smartest solution tonight. Okay. First, we will talk about the diagnostic classification for malocclusion with facial convexity. During the previous course, the other lectures has just talked about the details about the classification. Okay, and today I will emphasize the last three type is the indication for S8 SGTB, which this kind of uh, type they has the retrusive mandible of the potential and the class 2 molar relationships also with three depth problem. We call it the deep overject, deep overbite, and deep curve of speed. This is the indication of S8 SGTB. If in your clinical work you found the patient has the three depths, that's always the indication for it. Okay, tonight I will talk about the advantagement of S8 SGTB. The biggest advantage of it is we can move the teeth efficiently while when we reposition the mandible. Okay, I will show you some cases from my clinical work and to elaborate the advantage of S8 SGTB. First, I will talk about the alignment and the expansion during the mandible advancement. And you can see he is a 25 years old gentleman, and his chief complaint is the crooked teeth, protrusive lips, short lower facial height. And if you check the picture carefully, you will find his chin point is just shifted to the left a little bit, just as the red line here. He is shifted to the left a little bit. As for the inner picture, you can see the three depth problem exists, which is the deep overbite, deep overject, and the deep curve of speed, and the class 2 molar relationship. That's the indication of S8 SGTB. At the same time, we found the midline on the mandible is also shifted to the left. Just you can see the red line here. That's because the premolar and the second molar here has two crossbite here, and that's the obstacle point to make the mandible shifted to the left. Okay, and then from the side you can see his mandibular is the horizontal growth pattern, which we call it is a low or average angle. Mandible angle is the horizontal growth pattern, and the protrusive lips and the incisor proclination here. And then the posterior and anterior radiograph shows the goning here. Both the left and the right goning is not at the same level, which means which also shows the shift of the mandible position. Okay, and also the OPG shows, you can see from the condyle to the gonium, the left is shorter than the right is, which means he has the mandible position problem at the same time. Okay, let's go back for the classification. Okay, this kind of a case we call it mandible retrusion dental envelope, which means the maxilla is not overgrowth, it's normal growth, and has the incisor proclination and the mandible retrusion problem at the same time. And then we put the S8 SGTB in place, the first time in place. As you can see, the two blocks here, the left and the right is not the same height. That's because the canting of the occlusion plane, which you know she is shifted to the left, and he also has the occlusal. He also has the canting of the occlusal plane problem. And then here's the animation in phase 1, and you can see we do a lot of expansion and the stripping, give the sweep, which give the space to let us to align the incisors. And from here, you can see we give the patients the cross traction to cure the crossbite here. We made the second molar to go to lean palatally, and the lower second molar to lean backwardly at the same time. And at this time, the block is just help us to give the enough space here to do the cross traction. After 10 months, always in phase 1, we need 10 months to let the mandible to adapt the new position. And after 10 months, you can see the overjet problem and overbite problem is solved. And on the left side, here's still some open bite here on the posterior segment. That's the task for us in phase 2. And you can see that that's changed a lot. The 3-depth problem is solved, and also the crossbite problem is solved in phase 1. Then here is the animation in phase 2. Phase 2 is just do some occlusion detailing problem, and we correct the midline problem, and we do the settle down here to close the open bite here. And this is the first time when the patient wear the aligner in phase 2, and then 9 months in phase 2. And after 24 months, we finish this case with S8 SGTB, and you can see the beautiful occlusion relationship of the teeth. That's changed a lot from the very beginning. The 3-depth problem is solved, and the molar relationship from class 2 is changed to the class 1 molar relationship. Also, the crossback on the premolar and the second molar is also solved the crossback problem, and also the midline has a good connection. Okay, from the profile, you can see we shifted the chin point a little bit to the right, and then you can see we increased the lower facial height of this young gentleman, and also retraction the incisors, which gave him a good profile. Okay, you can see the side we retraction the incisor that will help for the profile. And also from the OPG, you can see here the both condyle, on the condyle, there's the double line here. There's the double line here on the condyle. It's the bone regeneration, bone reconstruction here. That's because when we made the mandible forward, and the condyle is subject to a force here, and that will let the adaptive reconstruction of TMG happen here. So when we take a look of the OPG, we can see the 2 bone layers there on the condyle. Okay, here's the two years follow-up of this young gentleman. You can see the profile is also very good, and the occlusal relationship is always the class 1 relationship, and the midline problem is crashing is perfect. That's the 2 years follow-up what we found. Okay, the next advantage we will talk about the crowding relief when we when we during the mandible advancement. Okay, here's a 20 years old young gentleman, and his chief complaint is crooked teeth and deep bite. And you can see the profile at the very beginning is not very bad, right? And his mandible is also the horizontal growth pattern. Oh, that's a good pattern for us to cure with S8 SGTB. And but for the inner picture, you can see there's a very severe crowding problem on the upper and lower dentation. And here's is the class 2 canine molar relationship here. And for this kind of crowding problem, I decided to have two two teeth on the upper extracted and one teeth here is extracted to give the space to relieve the to give the space to align the teeth when we do the mandibular advancement. Okay. As for the classification, okay, that's a word I always I always say it's not very good. Okay, and this kind of problem we call it is mandible retrusion skeletal 2, which means his maxilla is overgrowth. There is a very backy elbow here, you can see, and also the incisor lean back, and and at the same time, this kind of case has the problem of the retrusive mandible at the same time. So this is also the indication, also a case good for S8 SGTB. You can see for this time, I have two teeth in the upper dentation extracted and one teeth extracted in the lower incisor, this area. And then we do the mandible advancement at the same time. I align the teeth at the same time. You know, when we do the mandible advancement, the lower dentation and the lower mandible is subject to a force to forward to move advancement. At the same time, the upper dentation is subject to a force to backward. So I just use this kind of mechanism as the anchorage to align the upper incisors. So you can see the animation in phase 1. I do the alignment and do the mandible advancement at the same time. And here's the S8 SGTB in the months and 2 months. You can see from this picture, you can see from this picture, the alignment is going on 4 months, 10 months, 10 months after the end of phase 1. We have aligned the teeth here, and they're all there, and the crowding problem is relieved at the same time. And there's still some space left here, and I just need to in phase 2 move the boulders to move forward to close the space. That is okay. And this is the 7 months in phase 2, and then 21 months in S8 SGTB. I finished this case. You can see after that we have the good relationship. The deep overbite problem is solved, and the class 1 canine relationship and the class 2 molar relationship, because there are two premolars is extracted. Two premolars are extracted in the upper dentation. So at the end of the treatment, the molar is class 2 relationship here. And you can see from the very beginning, the crowding problem is solved and the deep bite problem is solved, and the occlusion relationship is very good. And you can see we also do the expansion of the upper dentations here. Okay, another thing I want to talk about is to do the occlusal settle down during mandibular advancement. As you know, this kind of patients often have the problem with deep curve of speed. So when we move mandible forward, there are often an open bite here on the posterior segment. That's because the deep curve of speed. So when we want to close or when we want to settle down the open bite here, we can choose extrude the posteriors, and we can choose to intrude the anteriors. So what's the problem? Okay, for the average to high mandibular angle type, we often choose to intrude the anteriors. That means for that we can control the lower facial height. Won't be too much higher. We emphasize much more the intruding of the anteriors here, and for the low to average mandibular angle, we emphasize the extrusion of the posterior teeth here. You can see just as the animation shows, just as the picture shows. Okay, for this case is one of the patients of mine who is 35 years old, and she chief complaint is the deep bite deficient lower jaw problem. You can see that the retrusive mandibular is very severe, very obvious here, and from the side you can see the elongation of the both on the upper and the upper and the lower incisor here. That means we need to do a lot of intrusion of the incisors. And his growth pattern is the horizontal growth pattern. He's the vertical growth pattern, which means he is the high mandibular angle type, right? So we need to emphasize the intrusion of the incisors. Okay, this is what the patient has at the very beginning. The very deep overbite and the class 2 canine and molar retention shapes here, and the narrow dental arch here, and some crowding here. Okay, when I ask the patient to move the mandible a little bit forward, you can see the open bite here. That means the deep curve of the spine. Okay, and then for the OPG, you can see the condyle. The shape of the condyle is not very good. Just as to say, the good shape of the condyle in OPG, just like the sum, just when we do the sum up, it's just like the shape here. But the condyle is not very good for this patient here. And okay, as for the classification, this case we call it is the mandibular retrusion class skeletal 2, also this type. And also this is the indication is good for S8 SGTB. This is the animation in the phase 1. At this time, we move the mandible forward. And at the same time, just you can see, I do a lot of intrusion of the anterior tears, both in the upper and the lower incisors here. And then I put two, okay, I see the picture when the patient wear the S8 SGTB. At this time, you can see I put 2 mini screws here, and ask the technician of Smarty to put 2 little buttons, which we called S15, to here, and then ask the patient to wear the elastic traction to emphasize the intrusion of the upper incisors. Actually, I will see the mini screw here actually is not very necessary. I will tell you why the mini screw for intrusion of the inside for the mini screw for intrusion the incisor is not very necessary. I will show you the next case. Okay, and then for this case I put 2 small mini screws here to emphasize the intrusion of the incisors. And 10 months later, at the end of phase 1, you can see after the intrusion succeeded, and the open bite here is the open bite problem of the posteriors is gone. Okay, so for this at this time, the task for phase 2 is much easier for us. Okay, here's the animation in phase 2. Phase 2, I just do some retraction of the incisors because I want to improve the profile of the young lady. And then I gave the tooth this kind of moment, some kind of expansion, some stripping, a little bit stripping, and then the retrusion of and then the retraction of the incisor here. And then at this time, do you remember the small mini groups here? I just put it out and move it to the back and ask the patient to wear the elastic traction to retraction the incisors and to give a good profile for her. Okay, 21 months later, I finished this case, and you can see the deep over bite problem is solved, deep over jet problem is solved, and the very good relationship, the class 1 Kina and the mold relationship here, and the expansion also is very good for the dental arch. Okay, here's the comparison. You can see the change, what have changed. And you can see the expansion that is very clearly. Okay. And the comparison of before and after for the profile, you can see the mandible is advancement. As the mandible is advancement, the profile is very good. And actually, we increased a little bit the lower third facial height, because the middle third facial height for this young lady is very high. So I want to look I want to the profile looks much more balanced. So I just increase a little bit the lower facial height here, and you can see that works very well here. Okay, and the self comparison, you can see I intrude a lot of the incisor here. Okay, here's the OPG comparison. Okay, let's just skip it. Okay, this is the TMG CBC TAMG CBCT. As before, you can see the space here before the slope, the space here of the space between the fossa and the condyle is very big, as when the patient is at the very beginning. After that, I have relocated the mandibular, and then the condyle just moves to a good position here. And you can also see the reconstruction of the condyle here. That's the adaptive remodeling of the condyle. Okay. Okay. The last part I want to talk about is sometimes there are some cases which is the we call the second-hand patient, or the treated patient, or the extracted patient. At the first treatment, this kind of patient has often four premolars has been extracted, but the three types problem, the deep bite, deep jet, deep curve of speed problem is just left for us. You can see this is the sixth case I collected from my clinical work. You can see so they have treated before, but the three deaths problem is just left for us. That's the task. Sometimes it's very tricky for us it's very difficult task for us to cure this kind of patient. Okay. And here's a patient of mine who is a 24 years old young lady, and you can see the biggest problem for him is the gammy smell. Okay, that's his chief complaint. The gammy smell very severe, and the deep bite often has and also she wants to solve the deficient lower jaw. You can see from the profile, the mandible is just always have the retrusive mandible problem. Okay, and from the side, you can see the elongation of the incisors. The elongation of the incisor is very severe. That means we need to do a lot of the intrusion of the incisors during this time treatment. Okay, the inner oral picture, you can see the deep overbite, deep overgiant, and also class 2 molar relationships. They are when we ask the young lady to move the mandible forward, you can see the open bite here, which means the deep curve of speed. And also there's some space left in the dentation here. Okay, for the OPG, you can see, wow, the molars, the premolar and the molars just lean forward. It's not very straight, it's lean forward. And you can also find the resorption of the root. Oh, that's really bad news, right? Okay, this is the animation in phase 1. Just as I talked about, you can see at this time, I do a lot of intrusion of the incisors without the mini screws, not like the case just now, right? We do a lot, at this time, I do a lot of intrusion of the incisors without mini screws. Why? Will I be successful, or will I achieve the intrusion? Let's talk about it. Okay, this is a example when we do the conventional clear appliance. I mean, not with S8 SGTB, just some other kind of clear appliance. Okay, when we want to do the intrusion of anterior teeth, we often put the horizontal rectangular attachment on the premolar and the molars, and this attachment will give us the anchorage to intrude the incisors. Okay, just you can see as it showed, the attachment give the anchorage to intrude the incisors. Let's go back to the animation in phase 1 with S8 SGTB. For at this time, the premolar and the molars, there are two big blocks here, and we ask the patient to wear S8 SGTB when they eat anything. Okay, eat anything. That means the 24/7 they must they must wear the S8 SGTB. So the block here has a very big occlusal force here, and this occlusal force will be the anchorage for us to intrude the incisors. So we do not need the mini screw to intrude the incisor here. Okay, just you can see this is S8 SGTB firstly in the place, and then after 10 months, you can see the open bed here in the buccal segment is much smaller, right? That's because we do a lot of intrusion, and you can see the gummy smell is gone here. And here's the animation in phase 2, and you can see I just do some occlusal detailing problem, the midline correction, the molar relationship correction, something like that. So some very easy task here. And this is the 7 months in phase 2, and that's what we finished. Let's see the comparison. The 3 depths problem is solved, and we have very good canine and the molar relationship here. And the expansion, we also do a lot of we also do a bit of expansion of this patient. And you can see from the picture, the gummy smell is gone. She has a very good smell after treatment. And the profile, the mandibular, we moved forward, and you can see in the chin much clearer, and we have very beautiful profile here. From the side, you can see at the very beginning, the incisor has the elongation problem, and after we intrude the incisors, you can see we have a very good connection of the incisor here. Okay, and this is the 2 years follow-up for this case. You can see the occlusal relationship remains very good here. Okay, let's give some summarization of my lecture. Okay, for S8 SGTB, they are the indication, or they are very good for the type, the last 3 types, the mandibular retrusion dental alveolar type, the mandibular retrusion skeletal 1 type, and the mandibular retrusion skeletal 2 type. The last 3 type is good for S8 SGTB. And these 3 types have something in common. They have retrusive mandible. They have retrusive mandible and class 2 molar relationships, and the deep over jet, deep over bite, and also have the deep curve of speed. These are also the indication of S8 SGTB. Okay, and the advantage, as for the advantages of S8 SGTB is we can repositioning the mandible and correct the individual teeth simultaneously. That's very efficiency, and we can correcting severe class 2 jaw discrepancies without surgery or teeth extraction. I think this is very good for the patients. It's very good news for the patients. And always, just as you see today, the case I show you, all of them are the adults, and it's very effective in adult patient therapy. Okay, and till now in China, we have more than 13,000 S8 SGTB cases in China, and I'm really glad to see your cases of S8 SGTB. And thank you for your listening, and that's my lecture today. Actually tonight I just talk about the advancement of the S8 SGTB. As for the classification, I think it's better to look the previous course of Smarty, and the other lectures has just talked about the classification of the different kind of patients, and then that's really good for you to understand the advantages of S8 SGTB. Okay, and questions tonight? For what age? Actually, for us, uh, nearly more than 80% of the patients for us is the adult. Actually, the oldest patient for us is like 69 years old for us. Actually, the condyle adaptive remodeling is a in the during the whole life we have the ability, the condyle has the ability to the adaptive remodeling of the condyle. Actually, if you found the case has three depths and you'd better to take a CBCT of the TMJ, and you can check whether the space of the condyle at the very beginning is very big, and I think that is the very good indication for S8. Don't worry about the age for the patient, I think. Just now the question is come from a doctor from Spanish, right?
I think so. We've got doctors watching our webinar from all over the world, like Spain or Italy or Colombia.
Okay. Sometimes I found the patients, the cases in China, uh, we found that sometimes it's kind of difficult sometimes in China. For I think maybe for the region problem or the growth pattern problem, for the cases in China sometimes always very difficult. I travel a lot of world around the world and listen to the courses given by the speaker of the of the foreign teachers, and I found sometimes just do some expansion, do some aligning, and that's finished. But actually, the case in China sometimes very difficult. Just as you can see it tonight, I show you. Okay. Any questions tonight?
So if we got no further questions, I think.
Oh, I think there's another question here. Time to change liners in each state. To change liner in each state. I actually we ask the patient to wear the S8 SGTB during even they are eating things. So every 7 days, every week, I ask the patient to change another aligner. So every week, 7 days we change another. 7 days we change another aligner. So that's the time we ask the patient to change the aligners. Okay. Okay,
And
another
one more.
question. Yeah,
Yeah,
another
so
question.
thank you for your informative presentation. I'm
Yeah.
wondering if there is a risk of recurrence with this treatment, and what is the recommended duration of containment?
Okay, and the recurrence is just the problem of when we give the speech all over the world or all over the country, the teachers, the doctors often ask about that. Actually, when we move the mandible forward, there are three reasons for us that the mandible is stable. The advancement is for stable. The first is the muscle memory. The muscle memory. We ask the patient to move forward for 10 months. The muscle is always always know where to bite. Okay, the first is the muscle memory, but it's easy to break. Okay, then another is the intercuspation, the good relationship of the occlusal relationship. So that will hold the mandible position. And the most important is the TMJ remodeling. These three reasons they together for us to make sure the mandible, the reposition mandible will hold the position there. Okay.
Thank you, Dr. Wang. Thank you for your insightful presentation.
Okay. Thank
But,
you. Yeah.
but before we finish up today, I'd like to show you our previous courses in 2024 this year, featured by Dr. Guo Tao, Dr. Alex, and Dr. Monica. So if you'd like to review those courses, you can always visit our channels at Facebook, LinkedIn, Instagram, and YouTube. Please feel free to follow them. And once again, thank you for joining in today's session. And thank you again, Dr. Wang, for your amazing lecture.
Okay. Thank you, everyone. Thank you, Fiona. Okay.
Yeah,
Okay.
and have a good day. Enjoy the rest of the day and night. Goodbye, everyone.
Okay. Goodbye.